Jazakallah khairan. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair for giving me this opportunity for discussing about Hijama, inshallah. Everything is okay? Am I audible? I think everything's fine, right? All right, so just let me share my. I'm not able to hear you. Are you guys able to hear me?
Yes, we are, Alhamdulillah.
Okay, alhamdulillah. Good. Jazakallah khairan. All right, so let's start with what is wet cupping. As we know, it's very common to understand what is cupping therapy these days, but Hijama, the word Hijama has been taken from the Arabic word Hajam, which means section. So, like in Hijama, what we do, we create a little section and the blood comes out. Because the pricks or the cuts are not so deep that the blood would start to bleed by itself, except by just sucking it out. That's why it's called Hijama, and we call it just cupping therapy. Now, if we see these days, there's a little confusion about cupping therapy. A lot of people misunderstand this cupping therapy because of the word cupping. Chinese cupping, for example, there are like many kinds of cupping going on these days. So, for example, now just to clarify that this is not hijama, we say it's cupping, it's dry cupping, it's oil cupping, it's like massage cupping. People are doing these cups to do these things. That's why we call them cupping also. But we know when we say hijama, it's just direct cupping, which means that we just make pricks and the blood comes out. And this is what is hijama only. And there's no other second form of hijama. Just one form of hijama, which is when we make pricks and then we just take some blood out. And this is hijama. Now, hijama, has had a past. Of course, we know that. I mean, uh, hijama is a part of the sunnah of Rasulullah sallallahu alaihi wasallam. That's a big thing. But hijama has been there since ever. There's one of the manuscripts, old manuscripts of medicine. It's called 𝐁𝐴 Papyrus, which is the Egyptian manuscript for medicine, and that goes back to 1550 BC before Christ. So, and in this 𝐁𝐴 Papyrus, there's mention of hijama therapy. So hijama is not what Rasulullah sallallahu alaihi wasallam talked about for the first time, but it was there already. And Rasulullah sallallahu alaihi wasallam, as we know, took the best, and whatever he did, from even the conventional thing, became sunnah. So after Rasulullah sallallahu alaihi wasallam, Unani medicine doctors took it, and as we know, Unani, we call this tib, and down the line you'll be studying more about this medicine, because this was the medicine of the time. Uh, Unani medicine, we call it Unani because Yunan, in Greece, has to do a lot to contribute in this system of medicine, but Unani medicine did not originate in Greece. Uh, you know, the history is actually, we don't know exact history because in this Mesopotamian ages, we find that this was the medicine of that time, and then went to Egypt. They fine-tuned it. Then Greeks took it, and then Hippocrates and Galen and the big names, took it and worked on it. So major contribution came from Greeks. That's why we still call it Greek medicine or Unani system of medicine. And then came to Muslims, because after Rasulullah Sallallahu, when Rasulullah Sallallahu came, he gave a lot of importance on health and wellness and healing. And the hadith which said that Allah did not send any, and close to the meaning that Allah did not send any disease without sending a cure with it. So, a lot of work was done on this. And the whole life of Rasulullah Sallallahu, was very well defined in terms of health and wellness. So the Muslim physicians took a lot of interest in this pathy, and then this United system of medicine really got a lot of contribution uh, in the in the Muslim golden era. A lot of schools in Baghdad and Spain and in uh, Persia, a lot of Greek physicians came into existence, and still they are very famous. And as we know, the names like a few of them, Abu Bakr Zakaria Razi, Ibn Rushd, and then Ibn Sina, and this Ibn Nafis, etc., etc. The canon of medicine, Qanun fi Tibb from Ibn Sina, was like a textbook of in medical schools in Europe until now, like 150 years back. This was the textbook of the medicine in the European colleges. So, and he's called father of modern medicine, like Hippocrates is called father of ancient medicine, or just father of medicine, and father of modern medicine is Ibn Sina. We call it in English Avicenna. So he wrote about 240 different, books and like smaller books and bigger books. Qanun fi Tibb has Qanun fi Tibb or Canon of Medicine has a lot of volumes, very thick, a lot of volumes. So now there's a good mention. These Hinani physicians, they they took Hijama very seriously and incorporated this practice into their general medical practice. And and then you see this in picture. This is from the European time. So as I said, just until 150 years back, Unani was there. This was not even called Unani medicine. This was called just the medicine of the time. And of course, parallelly at the uh, in India and China, Chinese medicine and Indian medicine was also going on at that time. But in European part of the world, mostly, and Middle Eastern part of the world, this was the medicine, which we now call Unani. And then after, this Arabs and Persian that took care of this medicine, then Indians, just worked on it and contributed a lot. So right now, India is one of the countries which has largest Unani medicine practitioners in the world, then followed by Pakistan, Bangladesh, Sri Lanka, and now, World Health Organization endorses it and wants to promote Unani system medicine because of its deep philosophy of how to treat a person. So, anyways, since today's topic is Hijama, we'll focus on Hijama now. So, even in Europe, Hijama was practiced, and it was practiced as they used to call it just medicine, and it was a part of the medical practice. Now, when we see that the penicillin theory of the germ theory came into existence, the bacteria, etc., then things have started to change. And this, some people call it naturopathic medicine, which is coming back now again in Europe. So the cupping therapy was a part of the program. Yeah. And then now again we see that Hijama is coming back. And it's not only in the Muslim world, but also, other healers are taking this Hijama into their practice. And a lot of professional athletes and sports people are, doing Hijama these days because of a lot of studies going on these days on Hijama, and we are seeing a lot of benefits of Hijama. So these days they're practicing in different in Germany, even medical practitioners are practicing, even in Canada these days practicing. But in Germany, other than Muslims, are also practicing Hijama in their medical practices. So Alhamdulillah, now for example, in Middle East, Alhamdulillah, for some reason, because of the Sunnah of Rasul Hassan, always did Hijama. So it's, right now I'm practicing my naturopathic medicine, my Unani medicine, and Hijama in Dubai right now. So we see the people here, they always did Hijama, their fathers did, grandfathers, so they know what Hijama is, always did. So now, because of the modern studies, so they have started to regulate Hijama also. So it's like a part of the medical system. in Middle East now, particularly United Arab Emirates. And now other countries in Middle East also they are trying to regularize it. Regularizing means two things. One is that they are serious about it. They consider it as medicine. And the other reason for regularizing it, because a lot of people who are doing hijama now, maybe they need to, because they need to understand that there could be some side effects of hijama if done improperly. So that's why this need came into existence. And just to tell you that one of the reasons why we have more hepatitis C, it is one of the reasons. There are other reasons also in countries like Egypt and also some other countries in the Middle East. One of the reasons is hijama done improperly, because a lot of people they do hijama and they're using the same cups of different people. They're taking like few people simultaneously. So hijama is wonderful, but it needs some care, etc. So now Rasulullah sallallahu alaihi wasallam, he, I was practicing my Unani medicine, naturopathic medicine. I practiced like the sister told. I had my clinic in Los Angeles for 9 years, and I was not practicing hijama at the time. And also maybe because I can say that my iman was weak, and still it is weak, but alhamdulillah, getting better. And so when I just read the hadith of Rasulullah sallallahu alaihi wasallam, that this is one of the best medicines. Actually, the hadith says, the translation, Abu Hurairah radiallahu ta'ala said, the best of medical treatment you apply is cupping. It's a very strong, powerful hadith. And then when Rasulullah sallallahu alaihi wasallam went on Isra and Miraj, that hadith says close to the meaning that no group of angels Rasulullah sallallahu alaihi wasallam met, but who didn't ask Rasulullah sallallahu alaihi wasallam to do hijama, and also ask for the ummah to do hijama. So it's a very powerful thing. There are a lot of these, So that made me think that I should be doing hijama. So if, anyways, so alhamdulillah, I started doing hijama. I incorporated this in my other practice. And for now, we started hijama in 2010, I guess, or in the beginning of, or in the end of the 2009. So since then, I'm doing hijama, alhamdulillah. And I've done, alhamdulillah, may Allah just protect all of us, thousands of them. And I'm happy I'm doing every time I do hijama. It looks like I'm reviving one of the sunnah of Rasulullah sallallahu alaihi wasallam, and I'm getting ajr. Plus, I'm having this confidence that this is going to help people. So I'm not saying like you should be restricting or limiting yourself to hijama only, and you shouldn't be going for other medical practice, or you shouldn't be seeking help in other medical systems. But what I'm saying, it is one of the best things we should be doing. And if you have some health issue, go and see a doctor, plus get hijama done also. So now, how hijama works? As we know that, first let us understand that, hijama, we do use these cups, as I just mentioned. It supports in the section of the blood also, but also if we just put these cups beforehand, so it kind of, just prepares the area. So it just pools the blood, pools the toxins, in that area. So it becomes easier for us to do hijama on this part in terms of the more toxins come out. The other is that, when we just put these cups and create suction, it kind of produces like desensitization in this area. So we just make pricks versus when we make the suction and then we make pricks, there's difference, and the latter is less painful. So these putting the cups. So first we just put this, we clean the place, And of course, just because I'm trying to just do a little short version of it, you'll be asking, like, you'll taking case history of the patient, why he wants hijama. There are some, contraindications, etc., of course. So based on the condition of the person, based on the complaints of the person, you decide which points you're going to select. And then you'll just put these cups, and then just wait like a few minutes, maybe 1 or 2 minutes. You don't have to keep these cups sitting for a longer time, because otherwise the skin starts to bruise. So, and then just take the cup out and then take little pricks, and then put the cups back in. So now, how cupping helps? So what happens in the body? And then we say that cupping is helping us. So now there are a few studies. For example, in when we take the blood out in blood donation, so we see some studies from this blood donation part. Now, there are these days, most of the doctors, as you might hear, that they're talking about blood donation, and particularly cardiologists, they say do hijama. Donate your blood, because this helps to just keep the heart issues away from you. Now, there's Dr. Philip D. Christopher. He was the director of Loyola University Health Blood System. He says that blood donation reduces viscosity. If blood has a high viscosity or resistance to flow, it will flow like molasses. So now what happens because of this viscosity of blood? So this is norm, particularly these days, because of our dietary habits and lifestyle. So the blood is more viscous, and if it is viscous, what it does, it just damages the intima, the lining of the arteries, which is very sensitive. So because of the viscosity, blood pressure also rises, and blood has to exert extra pressure, and then that causes damage on microscopic level in the artery, in the intima or the lining of the artery. So when this happens, we know that the cholesterol, which is flowing in this blood, that just comes and tries to heal the place. And if the damage is continuous, the process of trying to just coat the artery is also continuous, and a time comes when they become a, kind of like a plaque. And then because of these plaques, the lumen starts to get a little narrowed down and causes constriction and less blood supply. So now this all start in the beginning just because of this damage in the lining of the artery. So when if we donate blood, this helps in just losing some viscosity, and the flow becomes better, which means that there are lesser damage to the artery. So according to American Journal of Epidemiology, they found that blood donors are 88% less likely to suffer a heart attack, and they are less likely to get strokes and even cancers, because one of the reasons for cancer is also inflammation. So now we see this simply donation, the regular donors, as we know that the interval between two blood donation is like at least 2 months, better 3 months. So if someone is doing it regularly, then he's likely to suffer from heart attacks and other conditions related to artery. And iron overloading is one of the reasons why we have a lot of diseases these days. Now, again, because of the lifestyle that we have, and for example, if someone is overdoing red meat, the person may have too much iron there, and iron oxidizes, and because of this oxidation, a lot of things happens. For example, cirrhosis of liver, and even liver cancers, dyslipidemia or hyperlipidemia, or bad cholesterol, and then stroke, type 1 diabetes. Because of inflammation, we have this pancreas not working, not producing enough insulin. Alzheimer's disease, this happens in the brain. So this happens because of iron overloading. So iron, if it is more than 100 nanogram per milliliter, maybe not a good thing. So also, for example, if a person is a smoker, because of smoking, people have a lot of iron in the stored in the body, and hemoglobin goes high. So now one of the things you can do about this, because there's no medication for this to reduce your iron level, except that you go and donate your blood or do hijama. So now all these studies that we saw here are uh, done on blood donation and not on hijama. But we extract this thing from this, that if through any means we just take the blood out of the body, this happens, that our iron goes down and viscosity gets improved. So now if we do it hijama, the same thing is happening, we are just extracting some blood out. So of course these benefits are there to be there for sure. So we'll have this benefit, but there are other benefits which which come only when we do hijama. So additional to this, which come only with the blood donation. So now other thing is based on Unani system of medicine, 𝐅𝐨𝐥𝐿 𝐔𝐬 𝐎𝐧. So we know, in according to Unani system of medicine, those who have been a student of Unani system of medicine in Balagh, mashallah academy, they are doing this level 1 and level 2 program of Hijama, of Unani system medicine, and it's very, very inclusive, very, 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 very comprehensive, and it's very, very in detailed program. And those who have not really joined this program, I would highly encourage those people to really just enroll themselves in Unani course done by Balagh Academy. So now then, in Unani, we know that there are different humors, and a lot of diseases are just because of imbalance in a particular humor. So if one of the humors has got aggravation in it, so if we do hijama, then we take care of that particular humor, and then we kind of balance that humor through that. And the other is by lymphatic drainage. As we know that, of course, there's a blood which does the healing and fighting and repairing, and then taking care of a lot of inflammation in the body. But there's another thing which is lymphatic. So now what happens, as we know, that blood collects and distributes oxygen, nutrients, and hormones, nourishing the entire body. So if there's any, also, for example, besides this, the role of blood is phagocytosis. For example, if there is any bacteria or virus enters the body, then we know that white blood cells and lymphocytes, etc., they get activated, and then they just phagocyte, they eat up the bacteria. But sometimes the endotoxins, or the residual of the toxins which the bacteria carries, still remains inside the blood. So besides this, there are a lot of things, going on every second basis in the blood. A lot of, body's working. There's a lot of wear and tear going on in the body on every day, on every second actually basis. So what happens that blood, what it does, it just takes them and then hands over to lymphatics. Now, lymphatics, what it does, that, for example, a lot of things happen on the what we call peripheral level in our body. So a lot of debris and worn out cells, even cancer cells, they're taken care by lymphatic fluid. So it just takes them, right, and then hands over to blood, and then blood collects from lymphatics, and lymphatics fluid collects from the blood. So when we move, our lymphatics move. So blood, for example, to just move, we have heart which pumps the blood. But to move lymphatics, we don't have any heart to pump it. So either we are very physically active, particularly in our back, we move it a lot because most of the lymphatic channels lie in the back. So lymphatic fluid collects a lot of debris, but there's no heart to pump it out, like blood has a heart to pump it out. So now this debris from the blood, they get dumped into the colon, and when we just evacuate, we just pass those toxins out. But when lymphatic channels, they collect debris, there's no way to just pump it out. So what happens? Uh, when we do Hijama, we just collect all these debris because in Hijama, a lot of lymphatic fluid come out. So this way, we just collect all the worn out cells, debris, and free radicals and inflammatory cells that come out, and we just remove them from the body. So if we don't do Hijama, otherwise we'll have to be really very physically active. Now, how Hijama may work is by injury effect. So for example, when we cause any injury to our skin or anywhere in the body, what happens? We have, our blood gets activated, as I just mentioned. So we have a lot of white cells coming in, and we have a lot of like monocytes and lymphocytes and neutrophils, all these things. And then they do phagocytosis. They just take care of that. So now when we do Hijama, we are actually causing this injury by ourselves. So we are causing that uh, this mechanism of pulling off these white blood cells and lymphatics to just activate it further. So this how body goes into healing mode. The other is local inflammation. So as we know, inflammation is nothing but a defensive mechanism of the body. So when we say local inflammation, two things happen. Number one, as I just said, WBC and all these things come in, and they cause little swelling in the area because of the cooling of these all uh, fluids in the body and that area. And then we have this redness in that area. We have a little pain because of the pressure. They are putting pressure on the nerves. We have pain sometimes. Uh, immobility of that area. So these few things we call inflammation. So now we know that body is trying to heal itself. So whenever there is inflammation, it means body is trying to heal itself. But if the inflammation is too much, it causes the problem itself. But in Hijama, we create this controlled inflammation, but this is limited inflammation. So it doesn't really bother, but at the same time, it activates the healing. The other is unblocks the blockages. So for example, in a particular area, we do. Sometimes there are blockages in one of the areas of body, particularly in the back. So if we make little pricks and take the blood out, it unblocks that area. It removes lactic acid, cortisol, adrenaline. So now we know that if too much cortisol is a problem, adrenaline causes stress in that particular area. And then lactic acid also causes pain. And cortisol may be because of stress, adrenaline because of too much caffeine, and also stress. And lactic acid may be because of eating too much carbohydrates, because lactic acid is formed as a result of carbohydrates. So the more carbs we eat, more lactic acid we have, and a lot of tension and muscles we have. Or it could be a result of just a muscle injury, or if we are doing exercise and we are not doing warming up and cooling down, and then we have this lactic acid staying in one place. That's why always start with a little warm up and then just do cool down after you exercise. So you just disperse lactic acid. So when we do Hijama, we just take these things out, and then we feel better, we feel healthier and better. Now, acupuncture pricks and pain responses. We know that acupuncture is a well-endorsed system of healing, and also World Health Organization endorses and acknowledges it. There are lots of studies about acupuncture and how it works. So basically what happens in acupuncture, when we prick the body, different places, it depends upon which part of the body is pricked. And based upon that part, there are certain triggers that happen in the brain. And as a result, our body produces, like healing hormones or pain relieving hormones, or just sedating or, calming hormones or relaxing hormones. For example, when we make pricks, endorphin and caffeine hormone, even dopamine hormones are secreted. So these are pain relievers and natural relaxing hormones. Now, when we make Hijama pricks, Hijama pricks are comparatively are little stronger pricks comparing acupuncture. So we have more stronger response of endorphin and caffeine and even serotonin. So we feel even much better and quicker than acupuncture. Release of interleukin, as we know, is related to the immune system. And when we make Hijama pricks, as a response, we have interleukin secreting. This how we get better immune system. There's a nerve spinal theory. So, for example, in the back, and as you know, spine is a part of the brain, and from the between two vertebrae, there's ganglionic fibers or nerve fibers coming out, and there's a different, for example, in a different area of the ganglionic fibers in the spine, they trigger different parts of the body or different vital organs of the body. So when we make pricks in a particular above particular spine area or vertebra, then the corresponding vital organs get activated. So now, how do we select points? As you might have seen, this chart is very common. Someone, he came out with this chart, just so that it becomes easier for us to identify the points. However, of course, these are not the only points that we can prick. There are other places we can prick also. But this is like it's like a it becomes easier, So, for example, like 1 and 55, we know that this is 𝐴𝐿 point, and we can just do Hijama. And this is what Rasulullah ﷺ, did Hijama mostly. And for example, 20 and 21 is the place where we kind of point for stress management, And there are different portions, as you're saying, inshallah, you will be getting this slide also. So you can understand better about this. So we are just trying to run a little fast because of the time. And there are other sunnah points, there are, for example, these points, Rasulullah ﷺ didn't know these points. Yafuh, the top of the head, So Rasulullah ﷺ had headache and he did here, and there is a qamah dua in the back, and then we know akhdain in the sides, al-kahil here. So also in front, there's one hadith says he did in front also, waraq it's called, and then foot point when he got a little injured, so he did. So, but again, these are not just my understanding that sunnah points. Yes, these are the sunnah points, he did it, but one of the other sunnah is also that wherever you need at that particular time, you just take care of that particular area and do Hijama on that. This is also sunnah. Why? Because Rasulullah ﷺ chose these points based upon the indication or the need at that time. For example, he had headache and he did on Yafuh. So likewise, but al-kahil, we hear it again and again, and hadith that he did Hijama on this. So what I do, I try to cover this al-kahil part and akhdain part, because these things, as mentioned in hadith more often. And then I just select the point based on the condition of the person or complaint of the person at that time. And there are some Hijama points also as per Unani physicians. So Razi, he had a good mention of that in this book. And inshallah, since you're going to join this Hijama course from Balagh, you'll be having more detailed points. They'll be teaching you more about this based on different humors, aggravation, and based on different condition of health issues. So it will be easier for you to select, inshallah, those Hijama points. Now there is acupuncture meridian points. As we know, there are like a whole lot of them, very minutely. So someone is really, the sky is the limit to what you can explore. So these are, can grab a book on acupuncture. So the theory is when you prick, like acupuncture pricks, then corresponding area gets stimulated, and this is how you just work in acupuncture. So the same points you can make pricks, Hijama pricks, and then you can achieve the same result also. There's a nerve organ stimulation, So as I just mentioned that, on whole spine, it's a part of the brain, and there are different ganglionic fibers passing by, So if you prick in certain area, then you achieve certain results. So, for example, the cervical 2 area, if you just make a prick on these places, then you stimulate this brain and eyes and sinus, etc. Likewise, so so for example, you do prick on C6 level, you do have parotidal thyroid, other places, and your upper limbs, they get, many times you will see patient complaining that they have numbness in so it means they might have a compression in C6. So basically, this is like 𝐁𝐸 area, C7, C6, like this. So then you will be able to help them get relief in the tingling or pain in the arms, etc. So C7 is good for thyroid and lungs. Now C7, C6, C5, T1, this is like up to T2, I think, is 𝐁𝐸 area. So likewise. And then another point selection, we base upon the local pains and stiffness. So for example, if a person comes, he just tells that he has or she has pain in the lower area, upper area, or wherever. So you just select the point based on his complaint. And also sometimes when you're putting little oil, always start with little olive oil. Olive oil, some people use just the red solution to clean it. That's good also. But I like to use olive oil. Sometimes I add a little bit of in solution and put this. But olive oil itself is a very good, sterilizer. So it is antiviral, antimicrobial. It has something called tyrosol, which is one of the strongest thing to be found in any natural source, which is antiviral, antimicrobial, antibacterial. So now when you use olive oil, also it helps in, less pain when you create suction, because if you create suction of the cup on the edges, people get little pain, and also sometimes even causes little bruise. But if you use olive oil, it becomes easier. When you use little olive oil and move your hand, then even your hand will be able to feel the tension in one of the areas if there is, and then you can decide where to cup on the person. So again, you can grab this chart, easily available, but as I said, you will be getting this slide also in chat. Hijama can be done on other places also. So these are the few of the points you can select Hijama. Now, of course, you don't do Hijama on the open wounds, You don't do Hijama on the eyes, So you don't do Hijama on the veins and arteries directly. Never touch an artery, Even the vein, you don't. For veins, there's another, it's called phlebotomy. They do puncture a vein. If you puncture a vein, the blood may not be in your control to stop it. If you puncture arteries, it will be a big trouble. So never touch these vein and artery and open wound. Now, time and dates and days, how to decide them. As we know from Sunnah Rasulullah Sallallahu, the best date is 17th and 19th and 21st Hijri calendar dates. So these are the best days. There are hadiths, there's a cure in this. So, and for days also, maybe Thursday and Tuesday and Monday are better. And some people say Wednesdays and Saturdays are not good days. But you decide, you do your own homework about this when related to Sunnah and hadith, I'm leaving it on you. And then what Hijama, you can do almost any day. It's not restricted to these days and dates only, but of course these are the better dates and days. But if you have, for example, headache today, it is better for you to go and do your Hijama than today, And indication, so for what complaints you can do Hijama? Well, you can do Hijama for, as I said, for general well-being also as a prophylactic measure. You don't have any issue, but you're doing hijama, inshallah, to keep the disease away also. But if you have, certain conditions, of course, you can do hijama. So there's a big list of what you can do: headaches, back pain, arthritis, period pain, injury, asthma, etc. You know, so hijama is really awesome to do all these things. But I just, wrote these conditions, but you're not these hijama is not limited for these conditions only. You can do hijama otherwise also. So basically, you just learn where you cannot do hijama on this condition. Otherwise, the rest of the condition you can do hijama also. So procedure, as we discussed, you put the cup first, make them prick, and then do suction. So, my opinion, because some people, they make bigger pricks, like some people do like 3 pricks only, but they make bigger cuts. My opinion is that make smaller cuts, but you can make more cuts. But in this way, the bleeding is in control. So sometimes you make bigger cuts and the bleeding doesn't stop. And also bigger cuts leave bigger marks and they don't go away and people don't like it, of course. So smaller cuts, they heal fast and there's no issue with the stopping of bleeding. So things are manageable and no marks, of course. Rarely you will see a mark. Some people's skin is, kind of sensitive. And even after 10 years, I see they have done hijama somewhere, or maybe for me also. And I see still the place where they did hijama. But you see like in 2 or 3% people, there's still hijama visible. But in most of the time, in just 3 to 5 days, the marks disappear. For how long you have to keep on sucking the blood? Some people say, you have to keep on sucking the blood until the blood stops. But you cannot do, because, as I said, some people, bleeding time is just disturbed, and then, or someone is on blood thinners or warfarin or coumadin, then blood will continue to bleed. So it doesn't mean that you will keep on sucking. So there's a limit of how much blood you can suck and any time. The best is you just limit yourself to 200 cc, 200 ml, or better for people who are starting just 50 ml, start with like this 100 ml, and then max go to 200, max 250. But better is within 150 to 200 ml. The amount of donation is 460 ml. So don't think that because you can donate 460 and I have to just today take 460 ml. Don't go like this. Hijama, even if you do 200 ml, it is better than 460 because you're just getting a lot of debris and toxins and worn-out cells in hijama, as opposed to blood donation, which is fresher blood comparatively. So what are the contraindications where you cannot do hijama? Of course, you start with the history taking, just check the vitals. If the blood pressure is really low, below like 160, better avoid hijama at this time. Or, so just ask the history. So if a person is on blood thinner medication, don't do hijama. If a person is anemic, below 9, don't do hijama. Etc. If a person is pregnant, first trimester, don't do hijama. If a person has low blood pressure, then maybe he has pain. Maybe you can do just 1 cup at some place, maybe, But for example, even in some person is having 170, which you can do in most cases, but do not touch the lumbar area of hijama because that causes vasodilation. And then sometimes, blood pressure goes down. So all these things, if a person has cancer and at later stages, don't do hijama. If a person, there are so many conditions also from regulatory point of view. So I'm not discussing those right now, but just, if a person is general health status is not good, debilitating patients, don't do hijama, So there is no age limit or under limit, For example, if a person is like could be like 12 years grown up child, you can do. And one of the things we think whenever we are doing hijama, we are doing like 9 cups or 7 cups. You can do 1 cup sometimes, and that's what is needed for the person. And that could be okay. For example, if a person is anemic, like 9 hemoglobin, you can do 1 hijama, 1 prick, because the purpose is to prick and to stimulate this particular area. And the purpose here is not to take a lot of blood out. Maybe just a few drops only. Still, it will help. So Anyways, post procedure do's and don'ts. Like if, for example, there are not many, but if a person, for example, has done hijama, uh, hmm, in my opinion, that there are not many do's. If a person has no contraindication where you can do hijama, it means the person is already safe. But for example, some people would say, and I also like to say, but some people would say, don't drink milk and don't take meat, etc., etc. You know, so don't do exercise and these things. All are good, but because you are learning hijama, so I'm just telling you, this is safe always to tell the people to, but just so that you know that the rule is, you know, don't eat a heavy meal because after hijama you don't want the body to focus on a particular thing, particular area of the body in terms of the circulation. So because we want even circulation. So now when we eat heavy meals, quite a good percent of blood supply is just focused on a digestion and absorption area. So and we don't want that to happen after hijama. That's why we don't want people to eat bigger meals. Maybe that's why people say don't eat meat and stuff because it takes a little harder for the digestive system to digest heavy meals. So um, uh, milk, I didn't find any studies on this, even from Sunnah point of view. If someone knows this, please let me know also. But if some people say maybe they have some hikmah, they have found something, so you don't lose anything if you just avoid even milk or dairy products for one day. You can be vegetarian for one day. That's okay. Some people say don't. I also sometimes say if the person's blood is little, thin, I said don't take omega-3 of fish that day because omega-3 is a blood thinner just because of that. And don't take shower right away, of course. At least wait for 3 hours, or maybe next day. And that's it. So what tools you need for hijama? You need autoclave machine on the left you're saying, because you need to sterilize. Of course, you don't use the cups again. Better get disposable cups and just throw them. Because if you're using plastic cups, of course you cannot you cannot boil them. So uh, just get the usable, disposable. I'm sorry, disposable cups always. But the tray, for example, you will be needing these tools. So kidney tray, etc. So you'll have to use them again. So what you do, just autoclave them. Get this machine autoclave. Or if you don't have one, get this boiling autoclave, a smaller machine, and then have this gown, etc. Gloves, of course, olive oil, some sterilizer, some water. After this hijama, some people need always it's a good idea to give water after hijama because blood volume goes down. So of course they feel thirsty. If you want to have some juice or dates with you after hijama, it's a good idea. Have a table with the hole for the face. Otherwise, the sometimes people come with a neck pain and they pain worsen because they are putting their neck on one side if there's no hole for the face. So these things, and that's it. And hijama, there are a lot of books about hijama. You can just get hand on those books, and then there are a lot of videos on hijama. You can learn from them. But very important is hijama is something which you learn by doing. So of course, do good in your theory about hijama, learn that, but assess someone who is doing hijama for some cases, and then inshallah, then you will know. And still, we are learning hijama. We find something new every now and then. So there's no end of learning. So inshallah, all the best. I would highly suggest you learn hijama. I would highly suggest you do it. And since we have to find some profession to do it, so why not to do some profession which is sunnah also. So every hijama you revive on sunnah. Every hijama, the person who is getting hijama then revives a sunnah. A lot of ajr. Plus, for sure, you're helping a person. So I still have to see a person who doesn't smile after hijama. So I like to just clean nicely Again, I use olive oil to clean the area after hijama is done. Don't leave the person in a bad shape with a lot of drops of bad doesn't blood doesn't look nice. So after you have cleansed him, just ask him to just see his back in the mirror. Always they feel happy to see. Otherwise many times people are having this notion that there might be a lot of blood going on the body because some blood work has been done. But when you let them see their back, they feel happy that it's all clean. So like this, and always ask the people after hijama that try to eat a smaller meal uh, and in general, and try to sleep early. And most probably they will have a best sleep of their life, inshallah. So all the best. And one of the other things is always charge money for hijama. And I see some people, they say that, it's a sunnah, we shouldn't charge. Up to them, but they have to be financially strong for doing that. Why I'm saying this? Because even Rasulullah Sallallahu paid some, ujra, gave some dates to the person who did hijama to him. But also because sometimes people, they do and they say we are doing it, uh, we are not charging it for some reason, but they may ultimately compromise the quality of hijama because at the end of the day, it needs some money to buy cups and all these tools. So we don't want any person to use the cups again just because he's not getting enough money. So because of this, helping someone by not charging him some money, you may get him some disease, which will cost him a lot. So charge money, not too much, but so that enough so you can buy tools and also you get some money for yourself, so you're happy and the person is happy. Inshallah. All the best. Jazakallah khair. Is there any question real quick we can take? Or we'll I'll just open the chat then. I think I'll have to open the chat. All right. Good. MashaAllah. MashaAllah. Just control. Good. There's a question I would like to clarify. Is the lymph drainage system moved by doing exercise? Yes, it does. But your back has to move more, also has to move because a good amount of lymphatic system lies in your back. So do some exercise which involves your back also. But subhanAllah, we are praying, mashallah, salah 5 times. That helps a lot. But also do some exercise because these days our lifestyle is additionally bad. The food is really additionally bad, more than ever before. So we need to do something additional in these days. So some exercise or maybe hijama helps. Can hijama be done to diabetic patients or cancer patients? Hijama can be done to diabetes patients, yes. But for example, if a person's blood sugar is more than 250, just ask him to just get in better shape and then come back. This way, at least you will just put him on for future so that he can really take care of the diabetes part also. And just tell him, just cut down in the carbohydrates, bread and rice particularly. I have some videos on YouTube on diabetes. This is one of my favorite subjects, and I did my major on this metabolic disorder. So this kind of my expertise also. I have a lot of videos on this subject on YouTube. Just Google YouTube my name like Dr. Iftikhar Ahmed Safi, and then you'll find a lot of videos about this subject. But you can do 250. If this is more than that, yeah, if it is under 250, you can do hijama. All right, on cancer patients, there are different regulations in different parts of the world. So just follow the law of your land. But my belief is hijama, yes, you can do. If the country you are practicing in allows to touch cancer patients, you can do hijama because as it helps. And there are a lot of studies done. Just Google them. But all the rule of general health status of the patient is still applied. So the general health of the patient doesn't permit you to do hijama, take his blood out, don't touch. It's not just the cancer thing. In any condition, you can't do that. Yes, you can do in fibroadenoma. Hijama, again, the rules of the general health status apply. Can we do hijama for children? Again, my opinion is not less than 12 age, 12 years, but maybe 1 or 2 cups can be done if needed. In under that, but a smaller cup maybe. But if you are practicing to be safe, not under 12 years of age. And for ADHD or learning disabilities, for sure, you can do hijama. But at the same time, when besides hijama, do other things also take care of what he's eating, caffeine and chocolates, and overeating carbohydrates, and there are so many other things you can do. Yes, but you can do it in ADHD, sure, it helps. Alaikum salam wa rahmatullahi. Is this happening? Ulcerative colitis, IBD, and RA. You can do hijama for sure. This will help you. There are some, points selection in the lower area, starting from middle and lower area. Ulcerative colitis also, but make sure the person is not too debilitated in ulcerative colitis. Then sure you can do it. There's one thing more. There are so many things, probiotic, etc., and just keep him away from wheat, sugar, and these refined oils. If someone is coming to you with ulcerative colitis, IBD, and RA, just keep these 3 things primarily away. Refined oils, any cooking oil, refined oil, just ask him to use ghee or coconut oil, but it has to be cold pressed. Olive oil is good, it has to be cold pressed. But other cooking oils, no, because they are highly inflammatory. The second thing is sugar, anything from sugar. And the third thing is grains, particularly wheat. So, just keep these 3 things away. Besides 4 things, any item, any food products in ready-to-go form, canned food or processed food, they have a lot of preservative and a lot of other things, added inflammatory things and chemicals. Keep them away. And other thing, a very important thing and very helpful in ulcerative colitis and IBD is Arabic gum powder. Arabic gum powder. Give him. This helps. Can we do hijama and conservation? Someone who had breast cancer. I have already applied that. Ongoing treatment, maybe 3 months. Yeah. Well, treatment, how many sessions you need to do depends upon the condition of the person and the complaint of the person. Sometimes there's just, for example, if a person comes with the pain in the knee area. So now this area needs to be stimulated more often, more frequently. In this case, you will be limiting the amount of blood extraction because you need to maybe prick him again after a month. So in this case, just limit the extraction of blood to 100 ml only, and then call him after 3 weeks or maybe 1 month, and then repeat him like, I have done hijama very successfully in osteoarthritis, knee pain, but in ACL tear, etc., hijama doesn't seem to be working very well, but still you can prick him to stimulate the healing. And there are a lot of other things to be done in that case, including exercises. But just if there's ACL tear, etc., just make little smaller prick just for the stimulation purpose. But if the person comes with inflammation and arthritis, pain, etc., without ACL tear, then you can do hijama and extract like 100 ml in 1 session. Call him again after a month. In my experience, 3 to 5 sessions really help to get rid of this person. I have had people who were praying, sitting, they couldn't, pray standing and sitting. MashaAllah, they were able to do their prayers normally. Do you use hijama in abdomen area? I don't do that. Some people do. Maybe they have reason for this. Why hijama helps someone who is possibly possessed by jinn? Allah knows best. But some people ask me this question: if hijama is going to help in case of jinn or sahar or ain, etc. So I always answer this: this is not my area of expertise. So ask someone who is expert of this. But being a Muslim, I can tell you that Rasulullah Sallallahu Hadith says hijama is a shifa from diseases, and the best of the medicine is like this. So in my opinion, regardless of the cause of the problem, if you do hijama, it should help, because Rasulullah didn't just limit it to if you have this condition because of this condition. He says it's a help, it's a cure. So inshallah, hopefully it will help regardless of the cause of the problem, inshallah. What would get the advice to rebuild healthy blood in a person whom a lot of inflow blood gets released? Just ask, get a quality food or a lot of vegetables. Meat you can take. I'm not against it. Meat is super duper food. We should take meat, eggs. We should take fish. We should take beans, etc. But meat has to be not just halal. Of course, it has to be halal, but also it has to be fresh because a lot of people they put a lot of antibiotics on it, and then they spray carbon monoxide to make it look red again because it's sitting there in refrigerator for a long time. So you know and have quality sleep, try to sleep early, do a little physical activity, and a lot of dua and sadaqah, inshallah. You mentioned that hijama can be done on any day. Should we consider the season and the humor? Sure, of course. Thank you. Jazakallah khairan. Can someone without science background get this training? I think today a lot of people who don't have science background, they are getting this training. Getting training, anyone can do, but this the question should be, can he practice, right? So this again depends upon where you are and if the law of the country permits you. But in Europe, in America also, there's a, I mean, to learn it properly and practice it under the supervision of someone so you can have confidence and you do justice with what you are doing so that no bad name is given to this practice. And then you can do, and also the see the law of your country. But for example, in the United States, there's a law called a Pastoral Medical Association membership law. So according to this, like anyone who has a cultural practice of or healing practice, or a religious practice, then based on that, you can practice your, healing modality. So just do this. There are some people they are doing in the United States, even in UK, a lot of people are practicing this, So the Pastoral Medical Association, and just try to find out how people are doing this, So learn from them. Alaikum salam wa rahmatullah. Why some people get blisters? Why some people get blisters after applying cups? Yes, if you let the cups sit for a long time, then chances are that they will have blisters. So just don't let them sit for a long time. Just enough, just maybe a minute or less. That's fine. If someone is okay, you can leave them for 2 minutes. Yes, ulcerative colitis. I have answered that. If someone faints during hijama, what should we do? That's why get training, the first aid training, always get training and immediately call the ambulance. Please spell the name of what? My name, Iftikhar Ahmed Saifi. IFTIKHAR Ahmed AHMAD Saifi SAIFI. And someone gets giddiness after applying cups. Someone gets just after applying cups or after making pricks. After making pricks, yes, some people are very, very sensitive. And many people, they may faint. Some people, not like 1% of the time, they may faint, or maybe they have giddiness. Not necessarily because of the amount of the blood that is extracted, because this is much less than the amount of donation, which is a safer limit. But some people are sensitive, I have had some people came to my clinic and I was making bricks, and someone who was standing, just by looking at these bricks, he got fainted, So some people are having this. My email address is DRI, I'll write it here, GRISSAIFI@gmail.com. But I'm not very good in emails, but sure, inshallah, I'll try my best. I heard we should not do hijama on Wednesday. Please shed light. I also heard, but no one says it's haram. Even in hadith, I think it's makruh. But some people say this is weak hadith. So I'm not going into detail of weak and what. I take it as a hadith also. So I try to avoid on Wednesday. But if someone is in emergency, some people come that I need this, I do it. I do it. This is, even some people who say there is hadith, it's not haram, it's makruh, I think. I don't know this. I don't want to enter into the ulama domain. Just please clarify with them. Do we need to take a license in the UAE to practice hijama? Yes, you need a license to practice hijama in UAE. I heard if someone faints during cupping therapy, we shouldn't panic. Of course, you should never panic, but do the needful. Whatever is needed, you have to do that. I always made light incisions to release the blood, but Ibn Sina in his Qanun mentioned to make deep incisions to release the humor for hijama. What kindly explain? See, this is right. I mean, really, when you have experience, right? So you'll know how to play with this. But in some conditions, of course, we need to do little deeper pricks. You are right. But at least for the first 100 cases, I would never encourage you to do these things. Just go slow and go sure. So make a smaller fix, and then you will learn with the passage of time where you can make little deeper fix. But deeper doesn't make the deeper, which may have misunderstanding of how deep you go. So just you will learn by inshallah time. But initial 1 year at least, go. I mean, in most cases, actually, even now, after doing this for so long years, I try to just make my pricks smaller pricks, light pricks. But of course, it depends on many factors. So in some cases, we have to make little bit deeper prick, but they are little bit deeper, not really deep pricks. Confidence. Please share some tips to gain confidence. Learn it properly, and then be in company of someone who's doing it. Assist him or her for some sessions, and then you will get confidence automatically. All right, now I have to leave. I'm sorry because I have to go somewhere. Jazakallah khairan. Very nice to talk to you. Assalamu alaikum. I'm really sorry. I don't want to leave, but I have to leave because I have some commitment. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khairan. Shukran.